Almost there. It's almost like school assembly, isn't it? The feeling of power. Welcome, everybody. My name is Simon Waring. It's my absolute privilege to be MC this morning for the launch of the Paediatric Palliative Care National Action Plan. Now, that is quite a mouthful. Anyone working in health, particularly palliative care, is swimming through acronyms. I think for this morning, we actually need to let the words linger. You're going to hear that phrase quite a few times. And so Paediatric Palliative Care National Action Plan possibly doesn't drip off the lips, but it resonates with the heart. And I can see that you're all wearing the heart badge this morning. Very briefly, I'm a health consumer. I have a lived experience as a carer in palliative care, and that's in both paediatric with my son and adult with my wife. I'm a palliative care advocate and speaker, and I was the presenter of the documentary Live the Life You Please, which was launched during National Palliative Care Week this year in May, that explores end of life and palliative care across Australia. I also need to say for the last 3 years, I've been the consumer voice on the steering group that has helped manage the Paediatric Palliative Care National Action Plan project. It's got an extra word, that one. Now, this morning, we had been hoping for our local elder, Auntie Joy Murphy, to welcome to country. Unfortunately, Auntie Joy isn't able to attend this morning. So I would like to make an acknowledgement of country. I acknowledge the traditional custodians who have lived and loved this country through the vastness of time. For me in Melbourne, I honour the Wurundjeri people, whose country I stand on today. I pay my respects to the old people, to the elders and the ancestors, who are the safekeepers and caretakers of the oldest living culture on the planet. And I extend that respect to all Aboriginal and Torres Strait Islander peoples with us here today. For this is the very bedrock of this place, our shared home and our special identity in the world, and a source of shared pride as Australians. So welcome to the Paediatric Palliative Care National Action Plan launch. I'm not going to tire of working. Eventually you'll get familiar with it. I'd also like to welcome our online audience. So this event is being streamed. So the wonderful panel are going to be staring down the cameras. So I'm just letting you know, we've got wonderful people joining us around Australia. Now, this plan is a result of the Paediatric Palliative Care National Action Plan project, which was funded by the Australian government over a 3-year period. So this has been a long journey, and it represents a significant milestone. It was developed in collaboration between Palliative Care Australia and PaPCANZ. For those who don't know that, that's Paediatric Palliative Care Australia and New Zealand. And it was through very careful deliberation and thorough consultation with a range of stakeholders. Now, this included consumers, health professionals, palliative care services, non-government organisations, and representatives, of course, from the various states and territories. It serves as a comprehensive roadmap for a unified national approach. It offers invaluable guidance and direction to improve outcomes for infants, children, and young people with life-threatening conditions, and of course, their families. We will hear more from our speakers this morning about the benefits of this plan. Now, I would really like to welcome our special guests this morning. We have Assistant Minister for Health, Jed Kearney. We have Dr. Michelle Ananda-Raja, our member for Higgins. We have Camilla Rowland, Palliative Care CEO. We have Jenny Hinson, Secretary of PaPCANZ, the Paediatric Palliative Care Australia and New Zealand. Ilse Hampton, Palliative Care Australia Board Director. Michael Wasley, CEO of Very Special Kids, Violet Platt, Palliative Care Victoria CEO, and Kelly Rogerson, Palliative Care Victoria Board Chair. And to begin, I would like to invite Camilla Rowland, CEO of Palliative Care Australia, to the lectern.
You can see why we chose Simon Waring as narrator of Live the Life You Please, can't we? Isn't he fabulous? Welcome everybody. Palliative Care Australia has been on a very long journey in the last few years, and this is the first ever national paediatric plan. I'm going to call it the plan because as much as Simon has the long name, we've been living and breathing it for 3 years, and we walk around calling it the NAP. But essentially for us, it's been a collective, collaborative design process, and co-design is really important. I can see some of the parents and families who have been involved in this, and I want to acknowledge people like Ryan and Karen and Jess and Beck who are here today, because they've been involved in the journey for the full 3 years. So not only do we need to thank them, but we need to thank PaPCANZ. We need to thank the Department of Health and Aged Care for funding this and really believing in this whole process and journey and this plan, to the extent where they've funded another 3-year project, which is to deliver some of the activities that come out of the plan. This plan does rely on the success of all the different states and territories coming together and cooperatively working to deliver some of the activities under this plan as well. So we're very excited about the next 3 years, but today is about acknowledging the importance of this plan. I also want to thank Tony and Annette who have led the project from the Palliative Care Australia team, and of course Sarah and Mel who are an essential part of the team project work. So this plan is not going to sit on a shelf. This plan is going to be really active, and we will be looking at its progress every few months. It is a roadmap and it does give us guidance into the future. The next 3-year project, which is going to focus on some guidelines and some other key aspects of the project deliverables, is just the beginning for us. There actually will need to be more projects that take the paediatric palliative care sector into the future and be part of this national health reform that's going to take place over the coming years. So, Minister, thank you for being with us today. We really appreciate it. And can I just say that when Minister Carney presented recently and spoke at the launch of Live the Life You Please, we had such incredible feedback from the sector about her speech and how it resonated with the times that Minister had worked with palliative care teams and really understood the importance of it in Australia, that we are absolutely delighted that she's our Assistant Health Minister. Thank you everyone who's been involved, and I'll hand you back to Simon.
Yes, the plan. Well, perhaps actually in a Pavlovian way, we've said it enough now, so now when we say the plan, you'll know what we mean. No, thank you for that great opening, Camilla. I'd now like to invite Michael Wasley, CEO of Very Special Kids. This is an organisation that's provided essential support to children with life-limiting conditions and their families, offering services such as respite care, end-of-life care and bereavement support, as well as family and sibling programs. Thank you, Michael.
Thank you, Simon. And I spent most of the weekend getting my head around Paediatric Palliative Care National Action Plan. I wish you had told me that on Friday. Plan sounds a lot better. Welcome everyone, both here and joining us online, to Very Special Kids and this new wonderful facility. We're delighted to be hosting the launch for what we at Very Special Kids believe represents an important milestone in the future provision of family-centred paediatric palliative care across the country. Very Special Kids was established in the 80s because families felt that they were missing the full support that they needed. Even back 4 decades ago, families generally were satisfied with the level of medical support that they had for their child during their times of hospitalisation. And with much improvement in medical care in the last 40 years, the 800 families that we support at the moment would still have the same summation. On reflection though, what has not probably kept pace with the advances in medical treatment is the support that the family need, as well as the child, within their homes and their communities. We see the new action plan as an important blueprint to ensuring paediatric palliative care improves its holistic approach to match the incredible advancements in the medical approach. Improved access, collaboration, advanced care plan, research are among the many, many important goals in this plan. Perhaps most significant, the plan aims to put the family as well as the child much more in the centre of services that are developed and decisions that are made. And equally significant, the plan targets community misunderstanding around children who have life-limiting conditions, around childhood death and bereavement through building community awareness. Palliative care for paediatricians tends to be a topic that many across our communities feel uncomfortable with. As a role, our Australian society is poor and not supportive enough when discussing potential death. Therefore, families supporting a child through palliative care often feel isolated. They yearn for more support, understanding, and a lot more human connection with the people they live alongside in their communities. Sister Margaret Noon is sitting in front of me here today, is the pioneer of family-centred paediatric palliative care in this country. She established the first service specifically for families with children with a life-limiting condition. She grew an army of volunteers, added important psychosocial and grief and bereavement support, and she built Australia's first designated children's hospice without the universal support of the health community at that time. Sister Margaret Noon was ahead of her time. The new hospice that we're in today has been designed from international research and will be world-class support for Victorian families. It's been designed equally to improve the clinical care and to present to children as their place away from home. But like Bear Cottage in Manly, Hummingbird House in Brisbane, and the eventual new children's hospice being planned for Perth, the clinical improvements had to be discreet. The facility appear nothing like a hospital. It needs to present as their special camp, a place of fun, warmth, colour and entertainment. And like this new facility, the plan represents a key moment in the provision of paediatric palliative care across Australia, where resource allocation, community awareness and family empowerment become the centrepiece for the development of a better paediatric palliative care. We're delighted with the plan. We look forward to playing our small role alongside all of you in ensuring that outcomes of this incredible initiative are realised. Congratulations to the Australian Government, Palliative Care Australia, PaPCANZ, and also to the families, children and health professionals involved in its development. Thank you.
Thank you, Michael. Well, now I'm thrilled to present our next speaker, someone who brings first-hand experience and deep involvement to the table this morning. Prior to entering the field of advocacy and politics, Jed Carney dedicated over 20 years to nursing, working in both acute hospital care and aged care settings. Today, as the Assistant Minister for Health and Aged Care, she holds a pivotal position in the dynamic reform agenda of the Albanese government. Please give a warm welcome to esteemed member for Cooper, Jed Carney.
Well, thank you so much for the lovely welcome. I'm coming back. It's nice. No, thank you, Simon, for the wonderful work that you do. It's so good to be with you all today. And thank you for acknowledging country in the absence of Auntie Joy. I too acknowledge that we're on the land of the Wurundjeri people of the Kulin Nations, and I pay my respects to elders past and present. Their custodianship for tens of thousands of years on these lands and waterways enriches us all. And I extend that respect to First Nations people with us today or listening online. I'm very proud to be part of the Albanese government committed to the Uluru Statement from the Heart in full. That's voice, treaty and truth. I acknowledge my wonderful parliamentary colleague, Dr. Michelle Anandaraja, the member for Higgins, some of you may not know, but Michelle and I work incredibly close together. Our health backgrounds means that we have a lot of shared interests, and we get up to quite a bit of mischief too, don't we, Michelle? We push the boundaries on a number of things, and it's great to have someone as brave and wonderful as Michelle. She's an amazing representative for Higgins. So lovely to have you here, and thanks for having me. Michael, how fantastic The last time I came here, there was nothing on the floors. There was still lots of banging, and there's still lots of banging, I think, going on, but it certainly wasn't like this. It is beautiful, and I can see now that your vision was absolutely spot on. It's gorgeous, and I can't wait for this to be operating and up and running. And sister, congratulations on the legacy that you've left. It really is amazing. Camilla, thank you for all you do and for inviting me here today. I'm really thrilled. Palliative Care Australia is an amazing organisation, and Violet, equally, thank you for having me. And all the children and families here today and everybody else. It's so wonderful to be here to launch the first Paediatric Palliative Care National Action Plan, giving it the full title. But I'd like to say a few words about palliative care. As you heard, I was a nurse for more than 20 years. Doesn't look like it, does it? No. And I not only experienced firsthand some of the most difficult and challenging times in people's lives, but I was part of a team of doctors, nurses, and other health professionals that tried to ease the burden of illness on patients, on their families, and their loved ones. Confronting situations, tough decisions, but always hope and always love. If I learned anything in nursing, it is that time is precious. This is why paediatric palliative care for infants, for children and young people must be individual and holistic. It must focus on the physical, emotional, social, financial, cultural and spiritual needs of the family and the children. These are the toughest of times for children, their families and their loved ones. I think last time I met Camilla, I talked about my mum's experience, which was a lovely experience thanks to the palliative care team that helped us through to her end of life. But I compare that to another personal experience that I had with my nephew, who was 17 years old and was only 16 when he developed a sarcoma. And it was a life-threatening illness. And to compare the two experiences of how we helped my sister and her family through that time to the time that we spent with my mum, I can see starkly why there is such a difference. For mum, it was about having all the family around, all her brothers and sisters. We were there all day, every day. But for my nephew, it was completely different. He didn't want us old fogies hanging around. He wanted to be out there with his friends and his 16 and 17-year-old mates. He wanted to continue to go to the footy club. He wanted to go to the movies. He wanted to go and have a drink. This is very challenging when he's on therapy, chemotherapy, making him immunocompromised. I would watch my sister try to smile as his beautiful, bald-headed, gaunt-looking boy would go off with his mates out the door. It was very challenging, but that's what he wanted, and that's what the family wanted. And I think that is why we need to make sure that young people are quite different in their needs and their wants. And that's why the plan is so beautiful. It's so beautiful because it really does empower the individuals and the families. And I can imagine it's only different again when there's a family with a very young one. That's why we're so lucky to have gorgeous places like this to help us through that. So I really am very, very proud to be here today. I want to thank everybody involved in this very important project. I know you've consulted widely. There have been so many voices, particularly those with lived experience, who've contributed to the plan. I especially thank Palliative Care Australia and Paediatric Palliative Care Australia in New Zealand. Is it PaPCANZ? Beautiful. I love that for your leadership. I thank the consumers, the health professionals, the wider palliative care sector and governments for their support and invaluable contribution. And I do acknowledge that the previous government was an integral part of getting this going. And it's so lovely to see bipartisan approach to things like this. It makes them even more special. The plan will deliver a consistent national approach to information and support for children living with a life-limiting illness, their families and their healthcare providers. It includes 4 high-level priorities: quality, access, information sharing and collaboration, and data and research. I really look forward to hearing how governments, how health services, our professionals, researchers, peak and consumer organisations will continue to work together to actually deliver the plan's recommendations. And to the people at the very heart of the plan, the children, the families, I want more than anything for you to benefit from the significant work that went into creating this wonderful plan. More than anything, it's about breaking down barriers and fear attached to the term palliative care. It's about understanding that paediatric palliative care isn't all about dying. It's about living every precious moment. Thank you.
I'd like to thank Assistant Minister for Health, Jed Carney, for being here today. Now, this is where I actually invite panel speakers to the stage, but as you can see, they've been incredibly patient, just sitting in front of you and the streamed audience this whole time. So perhaps, rather belatedly, we should introduce who is actually sitting in front of you this morning. In the middle, we have Jenny Henson. Jenny is head of the Victorian Paediatric Palliative Care Programme, which is a statewide service for children with palliative care needs based at the Royal Children's Hospital in Melbourne. She has a PhD in this area. She has contributed to many texts and journal publications. And as I mentioned earlier, she is currently Secretary of PaPCANZ, which is the Paediatric Palliative Care Australia and New Zealand. Over on the far side, we have Sarah Fleming. Now, Sarah is a paediatric nurse practitioner with over 25 years of experience in this field. She is currently a consultant for Palliative Care Australia, developing education on communication, as well as developing resources to support families in rural and remote settings. Sarah was recognised in last year's Australia Day Honours for outstanding public service to the development and provision of palliative care services. We can do a round, can't we? Even a golf clap. No, very close. And I would also like to introduce Ryan Fowler. Now, Ryan, together with his wife Karen, who's also in our audience today, founded the charity Rio's Legacy after losing his son Rio in January 2018. Now, the charity, which has since raised over $729,000. Yeah, we'll take a moment to absorb that. Was established to assist children with life-limiting conditions and their families. Ryan received the Pride of Australia Award for service to children's palliative care services. Come on. Now, my memory is probably a 3-second memory, so I have my questions. We're just going to run through some questions with the panel about the plan, which by this morning might be known as the P. I don't know which way we're going. You know, sort of. Now, unfortunately for our wonderful audience watching on the streaming service, we aren't able to take questions. However, for our audience sort of sitting in front of us, we are going to be able to take some questions to the speakers later on, and there will be a roving maestro with a microphone. And can I just check, is my mic now working? Fantastic. Just think about it as the front. We're in the front room.
We're so not
you know.
Really not.
So it's going to be 5 points for each question. You'll start. No. So I'm going to start. I'm going to start with Jenny or Jen to me, Jen, because I know there was a time going back probably 4 years when the idea of this was a mere seed of an idea. There was an opportunity possibly for some funding, and there were a whole series of conversations through PaPCANZ and Palliative Australia, and to actually sit here now is extraordinary. And so just to reflect on that, what are you most proud of in this plan?
Well, you were very polite because you talked about Sarah's 25 years of experience, but you didn't mention my longevity, which is of a similar. So I actually just suddenly now am feeling a little bit emotional because I'll take you back further to when we started. There wasn't such a thing as children's palliative care, and it's not that long ago. And adult palliative care had been in existence for decades. And I'll come back later to perhaps why that was. But to me, starting out as a young consultant 23, 24 years ago and trying to break new ground, the idea that we would be sitting here talking about a national action plan, which was something I could only have dreamed of back there. So I guess that's really grounding for me to reflect, that we've come so far, and it feels like we're now just taking it up the next level. We're just shifting up a gear, which is extremely exciting to me. I think I'm incredibly proud of the involvement of families who are going through this or have been through this, who've been key to the development of this plan. Is something I haven't really been part of something where people with lived experience have been so interwoven in something like this. And I think it really gives heart and soul to this document. And then the other element to it is, there's a huge amount of clinical expertise that's gone into this. And one of the wonderful things about children's palliative care in Australia is that there's a culture of collaborating across nationally. So when I was starting, Sarah was helping me, and then we've helped others. And that, I think, comes through in this document. And I think it's rare to be able to get so many disparate services and individuals behind something like this. So there's a few things I'm proud of, but the fact that it exists is pretty amazing to me, looking back where I was. Yeah,
no, I think that's fantastic. Thank you. Sarah, coming to you, which is interesting, is you've actually explained the background that you've both had sort of in this field. If you actually, again, try and stand back from all the activity of the last few years, what are the 3 things you want people to be able to take away from this plan?
So much.
I know. I'm trying to, we could say, 10 things?
I reckon we should stick to the vernacular of the plan. I was sitting here thinking national action plan is actually it. I think nationally we have shown that we all work together and work really well, that we have meaningful partnerships in our community with other service providers, and people are coming forward and saying, we actually want to work with you on this. And we may not be the experts in the field, but we know that we have a role to play in delivering services. And so that to me is, really exciting, and it's a way forward of how would we harness that the best that we can. Action to me applies to the families. This plan for me, I'm the same as Jen, but emotional. So many families over 25 years have informed me, but this time we've got families have informed us as a group, and the action from the families, and the fact that the families are more than ready to speak up and to lead how this needs to look. Not what we think we want to deliver necessarily, but what the families are telling us needs to be delivered. That's extremely exciting that we've, flipped that right over, and it's not just it's nice to consult the consumers. It's no, they want us to go this way, and that requires more bravery, more resources, and all right, buckle up, here we go. And then plan. You can sit there and go, what can we improve? And everyone's going, oh, everything. We're going to fix this. We've actually got a plan. We actually have a blueprint that says go here, and the sense of excitement around, well, this is what we need to do. The small matter that we now need to resource doing it, but the fact that we've got that and we've got direction, and we can harness all those energies from the services and from the families that we're working with to get on with it is just fabulous.
Fantastic, thank you. And I know I asked 3. I know you could have, if I'd said 10, you'd still be going. So
no, this is good.
We'll come back. So Ryan, let's talk about the plan. How do you see the plan supporting your work and the aim of Rio's legacy?
Yeah, it's a good question. Obviously, I come from this from a twofold. Obviously, first as a father, that lost his little boy, and with my wife Karen, and I probably tried to look at it initially like we've set up a charity and my personal journey, but I think my personal journey embodies what we do in our work and the charity and what we're trying to achieve across nationally things. I think the biggest thing for this National Action Plan moving forward is having that collective voice, having that something that getting states to work together. I mean, when Karen and I went through Bear Cottage with our little boy Rio, yeah, there just wasn't, and then after he passed away, there wasn't a lot of, well, yeah, there's Hummingbird House, but there wasn't a lot of communication at times. And I know Very Special Kids have done a great job in that, and I've worked since I've started the charity with Michael a lot in terms of, I think we've had many conversations around having that national approach, having that national working together. We're not fighting each other. You know, we're trying to help these families when they need it the most. You know, and I've lived that experience. So I think that's part of our charity as one of our aims is one of our initial goals as a charity was to say there should be at least one of these in every state.
Yeah.
Now that's a big thing to do, but that's why I'm so proud to see one happening in Perth. When you compare to over in the UK, 50 odd, and we've only have 3, and we've got a 4th one and there's still issues around trying to get them up and running. To me, I'm sitting there going, okay, this is what started us up as a charity,
Yes.
and going, okay, we need to champion this. So to actually have a voice, and obviously, working with Annette and Tony and getting this through, I know it's not easy, but actually saying, okay, there's something here where we can come together. And for us as a charity, we can champion that. That's what we're about. We're trying to champion these places. They do amazing work. And if we can see there's a collective around that, I think that's where the action plan will help us in our work. And to say that, we've had a little bit of that helping out and supporting that. I think that's a big thing from our charity point of view.
And I think because as Sarah said, there is now a plan, a whole series of actions. So there's a roadmap.
Yeah.
For people who are, because obviously we've probably been living this for a while.
Yeah.
So for someone who's coming across it for the first time, what's your message to those people in terms of some of the actions of the plan? What should they be looking for?
Oh, obviously, I think being able to recognise what they're going through and understand what they're going through. I know when Karen and I went through the hospital, and there wasn't a lot of information around there, and we felt at times the doctors telling us what was going to happen and what was going on, rather than going, well, actually, no, we're journeying this through.
Yeah.
And my wife, we were with Rio the whole time, and he didn't have an easy, and even at Bear Cottage, they tried to, this is how, but it wasn't the case. They still had to treat him and stuff like that. So I think the biggest thing is coming through going, well, because of that, hearing the parents and going, yep, they know what they're doing, and trying to journey that with them rather than being told what's going to happen, because everyone's different. And I think they tried to pinpoint my son, but unfortunately he had a condition that they didn't diagnose. They couldn't come up with an actual diagnosis. So understanding that, and your voice matters. Because as my wife said to me, and it's right, you're a parent. Your job is to support and love you and guide your children. And at this time, I remember it. I couldn't. I'm a dad trying to look after my son, and I can't control what's happening to him. I can't, and that's taken away from me. So I think this allows us to bring that back for us as parents. I don't want to get emotional, but as parents, and to go, okay, I think they're starting to hear that. We're part of that process, and this is our child. No matter, they're fearfully and wonderfully made, as we say.
And look, Ryan, this is emotional. This is emotional. It's emotional for everyone who sort of works in it. So thank you. Sarah, I'll keep this really simple.
All right.
What is needed to continue the focus of paediatric palliative care in Australia?
Yeah. I think we need to stay faithful to what we've been told, and I think we need to stay centred on the child and the family and what actually contributes and makes a difference, and also what the stakeholders have said they need to help do a better job. So I think it's remaining centred and not running off on too many red herrings of this might be a good idea, that might be a good idea. Stay focused. Yes, where we're trying to go. And then, continuing to find opportunities for resourcing to get these things up, because they because of the uniqueness of what we're doing, and that's been identified well in the plan, we have to do our own thing in paediatrics. We have to develop our own sets of guidelines and all sorts of things. So it's resourcing that and looking for opportunities for resourcing to just get it up and running. Yeah.
Thank you. And I'm going to ask Ryan something. When Sarah was talking initially, I asked about the 3 key areas. She made quite a point about the involvement of lived experience and listening and consulting.
Mm.
Something we've heard over the last 3 years of this consultation, which has led to the plan, is the voice of the child and the family not always being heard. And the first action in this plan is active involvement of the child, the young person, the family, and the community. For someone who's coming to this relatively new, can you just explain why this is so important?
100%. I'll try and explain the best way I can. My wife's way better at doing that, but I'll try and explain the best way I can. Look, we were hit with a tidal wave of Rio from that point of view, but the reason I think it's important is because I've got an example. I'm not going to name, but obviously when we were in hospital and Rio's condition was, he was hit in so many different areas. And I remember sitting with Karen and we had one doctor telling us, we don't know what's going to happen. But then I had another doctor from another unit saying, you'll be home by Wednesday. And I'm like, he's like, no, you'll be home by Wednesday. And I'm pretty easygoing, but I was like, you guys need to, there was just, and he didn't want to take on what I wanted to say as a dad and my wife. And we went, I won't tell you what went through in that journey with Rio, because he had to have a few amputee operations and stuff. So that really, I suppose I felt devalued in that regard. So that was a big thing for me. Us then coming to Bear Cottage was, I suppose that's where we felt for the first time we sort of felt, okay, they get it, they understand it. Rio's condition was a bit different. So I think the reason it's so important is because it allows, parents to say, hey, this is how not everyone's, you can't cookie cut everyone into the same, they're all different. Okay, my son didn't have cancer, or he was diagnosed with it wasn't a diagnosis, it wasn't a cancer. So it's one of those things going, okay, we need to hear each one's story, we need to understand it, and know that they're going to get supported through that. And I think that's important to hear, because I think previous years, maybe that's not happened. But I think now, hopefully, moving forward, that is going to be the case. I agree with what the acting health minister said around, I watched my mum go through adult palliative care, difference to the paediatric, that's completely different. I remember going to Bear Cottage 100% against it, going, this is it, you're giving up on my son, what's going on here? And I've done a complete 180 around what, and Narelle, who's the manager at Bear Cottage, is saying, they come here to live, not to die. And that was a big thing for me, and understanding that journey. And Narelle and her team at Bear Cottage really set us up going, well, this is why we want to champion. So I think it's a big thing for that, for families to know, hey, because sometimes when you're in those meetings with doctors, you feel like the small one. You don't know, understand, but Karen was in there every night dealing with what's going up, and the doctor's going, we don't know what's going on. So I think that's a big thing about having that, that our voice is heard. I'm not saying not heard, but then taken on board.
Yes.
And one of those things. Sometimes the voices are heard, but it's actually taken on board going, okay, we need to probably approach this a bit differently.
No, thank you. Thank you for explaining that and sharing your story. I've got a great question for Jen, of course, but we do have a little bit of time up our sleeve, so we are going to have some time to take some questions from the audience. So I'm just get the brain going. And who's got the microphone? Who's going to? There you go. So now, Jen, there are people in this room who've been living with this plan for 3 years, 4 years, and absolutely up to their ears in all the detail. I think it's really important for somebody who's receiving it for the first time, opening it for the first time, could you please share a high-level summary of what the plan really means for the sector and what it means, what you think it means for the future?
I hope I can express myself well, because it is complicated and I keep going back and forth in time. As I said before, I think this represents a once-in-a-lifetime opportunity to take children's palliative care forward. It's a mark of maturity that we're thinking, we are thinking about the family voice, it's crucial. And we're turning our minds to, we must somehow measure outcomes, we must participate in research, and we must use that research to improve outcomes for children. And we need to be systematic. And But we must never lose our heart, because sometimes when professional groups get enthusiastic about measurement and research and things, they lose the heart. And that's a bit harsh, but I think you know what I mean. And I think listening to Ryan and listening, if there's one part of this plan you read, please read the foreword that was written by the families. It's beautiful, and they talk about what this means to them, and that it is about living. People think about dying. And so just hold that thought and go back 23 years to when I started. And I said, when I answered the first question, it's surprising to think that adult palliative care was so well developed at that time, but children's palliative, it wasn't a specialty area of medicine. And you have to ask yourself, well, why was that? And I don't really know, but I think it was something to do with the rarity of it, the relative rarity of it, people feeling helpless and like this was all just terrible and nothing good could ever come, nothing could be salvaged. And that each clinician would kind of just get through each case in the best way they could, which was lovely, but there was no systematic approach. There was no trying to learn from the group or to do all of those other things that I was talking about. And so I think we were sort of a bit disabled. We felt a bit powerless. And so if you think back to that, and now you think, we're starting to think more systematically, we're starting to engage with families who are going through this more meaningfully. We're starting to think about outcomes and research, access. How do we make sure families can access palliative care services? How can we make sure when they get to us that it's what we might regard as quality? And we're still on a journey to work out what that means. So we need to balance doing all of those things with never losing where this all came from, and that we must also retain the humanity and the connection with the families that we look after. It's very long-winded, but
No,
I hope you understand.
Jane,
It's
yes.
a juggling act.
I was just going to, can I add on? I
Of course you
was just going to add on because I agree with that as well. And because the big difference between a hospice and a hospital is one big thing is understanding that process. Because I agree when you talk about the systematic at the heart of it and understanding how that goes. But where I was going to come from is going, well, kids happen in there's no clear cut like I talk about, so obviously people use services like hospices here, like very special kids, and it could be short time or it could be a long time. Whereas obviously when I went through with my mother, there was sort of, we knew it wasn't going to be for so, and palliative care has that. So it's just unfortunate when you talk about palliative care, that word, that straight away everyone's mind just goes to boom. It's then understanding, well, actually, no, there's more to that. And we saw that, what Bear Cottage and that offered my daughter, who watched her brother pass away. She has no fear of Bear Cottage or the hospital, bit different, but it's understanding, medicine's all about trying to save, we save, and understand when you talk about kids, who wants to talk about a child that's sick and then on top of that's going to die? That's a tough conversation to talk about. And I'll never forget my wife and I had a meeting with the head of Sydney Children's Hospital in Randwick, a lovely guy, but obviously he was the head of intensive care unit, and he actually said to us, he said it's neglected side of medicine. He said, I can get funding for whatever I want for these machines to save lives, but when it comes to that, it's like, well, what's going to happen? And so understanding that is a big thing. I think that complements and going in that, okay, it's having those systems. How do we work this out? But understanding that, it's we're not going to save lives. It's always a difficult thing, but it's making that process, that journey.
And can I add to what you said in return? I'm talking about being systematic, but we also need to think at a systems level, because we talk about place of care, and for different families that'll be different. For some families it'll be at home, and for some families it'll be in a hospital just due to the complexity of what they're going through, and for some it will be in a hospice. But actually they move between all of these places of care, And so we have to think at a systems level. It's not about a place.
No.
It's about a system that supports a family wherever they are.
100%.
And it's just as important in a hospital, in the home, in a hospice. We can't disconnect all of these things. We have to think of it cohesively and make sure all of those, and I think that's why having sort of some of the high level services that we have in many states to kind of take a helicopter approach and make sure families hoping, we're trying to make sure they're okay wherever they are. And I think the plan is talking about strengthening all of the elements regardless of where families are. So we have to be systematic and think at a systems level and not be too focused on our little piece of the puzzle. It's a puzzle, we need to put it all together.
See what an amazing panel we have this morning. So, roll up. With some questions. Okay, now.
Oh, tough call.
Name's gone past you, boss. I'm sorry. I was part of a Palliative Care Association back in the 80s, and in fact, I think I was one of the original ones there. And they also used to talk about thousands of things that they needed for adults. And I'd sort of put up my hand and say, what about the children? And there wasn't any response. But when I started Very Special Kids in 85, it was a couple of families who recently had a child who died, who called it Very Special Kids and who wanted to get other people involved who had a child who had died. And there wasn't any response, certainly from the hospital. So we pushed on, and we had more and more families who came to us for support. So it goes back much further than 25 years ago. It goes back to 85. And I just come back from overseas and working and so forth, and watching the hospices in England grow. So Helen House was the first one in Oxford. Martin House was the second one out of York. And then they just grew and grew and grew. And every year when I went over, there were more and more hospices for children. So it goes back a long way. And I think that it needs to be acknowledged that Very Special Kids really did set the ball rolling.
Thank you.
So my question's about that systems approach, and I've been around long enough to remember when I worked in palliative care, we didn't have paediatric palliative care, and I lived in and worked in a rural palliative care service that used to refer to Melbourne or Sydney. And so a parent would have to take their child, and one parent only, to either Sydney or Melbourne, which left their family behind on the property or out in the rural town. So this blueprint comes back to that coordination and collaboration that Ryan spoke about, person-centred coordination and collaboration. So I see this plan as potentially helping inform other health sectors that we interconnect with. So my question to one of you, and probably it's going to be Jen or Sarah, is what are the first sectors of cabs off the rank that you'd want us to see us promote this to in other health sectors?
You go. No, you go. No, you go.
That's so polite.
I think we have. Look, I'm thinking the thing that comes front of mind at the moment. I think community palliative care who have been wonderful partners actually through this. And when I first started, Margaret will remember as well, they were absolutely terrified about looking after children. And many of them still are. but they have been so brave, I have to say, and now 25 years on from our services point of view, we have very good partnerships. I have a bee in my bonnet about after hours. That is that if I could, one thing before I retire, if I can feel confident that families have support outside of business hours, And I mean practical, roll up your sleeves, come round to the house and help support.
Not just a phone call.
And also for adult patients, you know, this is what we all wish for the people that we love, especially if we're a parent of a child. It's absolutely terrifying. And some families really, really want to be at home because their kids have told them that that's where they want to be and they want to honour that. And so I'm full of admiration for community palliative care. They've done an outstanding job and been wonderful. And they have limited resources, and I would love to see something happen around after hours. This is my chance to say.
You go for it. You just grab that, Jen. Good job.
Jen, you have a stage, you
Yeah,
have a
yeah.
microphone.
Don't ever put me on the stage.
So, what was your thoughts?
Yeah, I think some of those partnerships, like in the disability sector, and because some referrals that we don't get are kind of known out there, but they don't come through. And so thinking about, it's a very heartbreaking thing. I know one of the hardest, a difficult piece of information to receive from a family was always them saying to you, "Why didn't we meet you earlier?" And I'd like to stop. It'd be nice if we weren't doing that so often. And also knowing that you didn't get to achieve with a family what you could have because it was too late. And so just that awareness and partnership amongst that to help people who are stakeholders providing the services and partnering with us feel less afraid or intimidated by this work and can feel better supported and more confident in what they're doing, I think would be really important to take that out there and make that work. And that this becomes something that people take pride in doing, that it isn't something of, I didn't sign up for that, I didn't sign up for children. And, I remember I used to tell people that I was a hairdresser if I just couldn't be bothered going through the sequence of, oh, you're a nurse, where do you work? I work at the Children's Hospital. Oh, what do you do? I do palliative care. And then you get that sort of constipated look back at you. It was like, oh. And, I would like it to be that service providers actually go, oh, yes, no, that's a new challenge. I remember there's a group of people that will help me with that. And these resources, and you can say, we're going to drop these resources in and this understanding and click on this learning program and, just make it work for people to feel more comfortable, but also more positive and enthused about doing this work. It's not a nasty little secret. This is an amazing, joyful journey with a family in its own way, and it gets back to what it really means to live. And so getting that out there and moving that to a different approach, I think would be really good. Change the energy.
Great answer, thank you. I'm just going to chat. I'm getting a little. How are we going? Yep. Okay.
Jess is
no. Yeah, I just got a quick one, Simon.
Yep.
I just want to, I'm a parent that's lost a child, a bereaved parent, and more want to share that the impact that palliative care had with us, and Jen in particular, was the first conversation that I had, and referred to by Juliana, who was our DedMed doctor, who advocated. So a lot of that advocacy that comes with that. And so she referred us early. And you never know when you've got a child with a life-limiting illness, how long you will have with palliative care. And we were fortunate enough with Henry that we had 3.5 years. And the main thing with my first conversation with Jen was, because when you get referred, instantly you think, oh, is he dying? And then the conversation I had with Jen when she said it's about the quality of life in the now. How can we make Henry's life as best as it can be? And then my biggest thing was, how would I hand that little boy over for the last time? I couldn't even fathom how that could be as a parent. And Jen said to me, we hope we're the people that you will have around, that you want around when that time comes, but let's do the quality in the life now. And they helped fund a bath bed, a chair for Henry at home and some tracking so that his quality of life was as good as it can be. And still, it's only 10 years on since Henry passed away, and I'm still really beautifully supported by palliative care. So I wouldn't have known any different if I wasn't referred, but I was. And I thank them that I am who I am today, even just to be able to sit here and speak like this, because of the impact that they had. And empathy is so important. And everyone in this room, you've got it in your fibre already. But to actually see it through, that this plan now is something that's really important. You've all got it the ability to understand the feelings of others and especially parents, what they go through. Mainly this is more of a thank you than a question.
No,
Thank you.
I think also it loops into something that Ryan mentioned earlier, and it's a phrase I've heard over the last few weeks where palliative care, it's not necessarily about striving to put years into life, it's about putting life into years or months or days or sometimes hours. And so that's the message. Palliative care is more than you think. We need to get that out there. Now, I think we're almost down to maybe our last question. And Jen, very briefly, and it is a quick one.
Is this a bonus question?
It's a bonus question. Yeah, look, it's up my sleeve. If we step away from clinicians and we're actually thinking about families and people on the ground, what's your advice to families and people? What do they do with the plan? How do they help get funding for it?
Gosh, look, it's not just about funding. So I'll come back to that. We have in recent years as a team had some wonderful parents, including you, Simon, and Jess, and others who are here today, partner with us or contribute, I suppose, to multiple elements of what we do. So, for example, a number of parents in the room made some podcasts recently that are available for other parents. We're aware that somewhere in the world, we know of at least, we know they've been listened to by many families, but we did hear a story about one parent who wanted to reach out to other parents, but didn't feel like she had the energy. But she's got the podcasts on repeat in her car. And it's just providing her with the most enormous support. So we recently heard this at an international conference. So the power of a parent hearing from another parent who's been through it is much more meaningful than anything I could tell them as someone who's worked with families for so long, but hasn't, I don't really understand it at that kind of fibre level. And we do have families help us with education as well of health professionals, and the health professionals will listen much more intently and they actually assimilate information. So I think that involvement at multiple levels, and of course families can be wonderful advocates at a political level, but I never like to ask them or lean on them for that, but some find their own way, like you did, Simon, to advocacy. And look, the raw fact of the matter is that we do have to compete, and we are a little bit small from a numbers point of view, but big from a needs point of view and a complexity point of view. So we have to be out there with whoever we can, advocating for, and it does require resources, it requires people, it requires money. And so I think we have to be lobbying at multiple levels.
Thank you. Yes, got one.
I hope it's a quick question. My name's Chris Pearson from the Epilepsy Foundation and represent rare and complex epilepsy families who have life-limiting and threatening conditions. Just expanding on your point, Sarah, about keeping the broadness of who requires palliative care. And I guess my question is, how do we keep that sort of window open, because our families are constantly not being offered these services, but also when they ask for them are not considered part of that framework. So question is, how do we keep that door open? And then also a challenge to how do we keep working together to make sure these families get the services they need?
It's probably a two-prong approach. One of the things we don't have, which is weird for me to say because it's not something I enjoy much at all, is data. But I think data of why children die and identifying how and who these people are, because I think we don't necessarily map that, and I think families will come up who were never referred to palliative care, but their child died of an illness that we're not picking up on, and start being able to represent that better. They're little silent voices sometimes, but also I think awareness and promoting awareness of what palliative care does and how we can work with what we would call, we in the business call it parallel planning. So, you know, there's getting on and doing things and treating and doing all that sort of thing. And then there's the big what if. Well, what if this didn't go well, or what if time was shorter than we wanted it to be? And thinking about that it's not like referral to a service that then runs away with the patient and family. It's actually working alongside and exploring that better and looking from the educational point of view of other specialties of what would it mean to work with us? What is it? What are the sort of criteria that should trigger that thinking? What is it that what are the layers of ways that we work, that we're more than just end of life care and palliative care, that families have a broader sense of need? So trying to work a bit more on referral. What does it mean to trigger referral? What are the elements of, what are the kinds of criteria that would meet that need, and how to filter that through without creating discomfort where it's not needed to be, but at the same time offering that same opportunity and equity to the more marginalised groups. And I think the important thing is to stay connected, but also to think about, you know, and learn from the families as well that maybe this has been a problem for, and say, well, what were the elements of that, and how do they repeat? Is there a common thing we could pick up that would trigger that better? Yeah.
Can I just say thank you to our panel, because there's been some, it's quite challenging sitting in front of a room of people and an audience online and fielding questions about a very strong but also very emotional area. So thank you very much for your responses this morning. And I'd like to invite Camilla Rowland to the lectern.
Thank you to the panel, Al, and to Simon. I think that's a very interesting discussion, and we started to talk about resourcing. And I have to say, as the Minister was leaving, she was very interested about the ability to meet demand or inability to meet demand in community palliative care. And I said, of course, I took that opportunity to say, yes, let's have a conversation about that. And so I think that will occur fairly soon, because she's very interested, because in her view, everybody that needs palliative care should be able to access palliative care at end of life in the community. So I think when you touched on those things, those elements of ensuring that it's person-centred, it's not just person-centred, it's family-centred. It's not just an individual child on their own. There's a whole family and a set of carers around that child. It's not just about the palliative care system, but the broader health system. And when we think about sectors, we think about epilepsy, we think about, you know, early childhood dementia, we think about cancer, we think about all the different other sectors we interconnect with. And this plan provides that roadmap or that blueprint for other sectors to look at, and for us to open doors in discussion with them as well. And I think this is the first document we've had that we can show to other sectors and say, this is what we aspire to, this is what we wanted to deliver over the next 10, 20 years. And of course, we'll need to update this as well as this plan unfolds. And, you know, if we think about paediatric palliative care is very city-centred, and those who know me know I'm a very strong advocate for rural health services as well. Palliative care in rural areas requires that locally formed and developed response as well. So as Ryan quite rightly pointed out, you know, the number of children's hospices is a very small number in Australia comparatively, and most of them are in major city centres, not in even major rural regional centres. So what does that look like for our future as well? Are they more hospices, or are they more collaborative, locally grown services that are wraparound for family? And what does that look like? And connections with local hospitals. So designing a system that is fit for purpose is part of this thinking as well. So thank you to our panel, and thank you so much, Simon, for emceeing today. It's given us a lot to think about how we use this plan, because I said this is not going to sit on a shelf. We haven't invested all this time with all the blood, sweat and tears of Tony and Annette, Tony Rice and Annette Vickery and the whole team, and all the people and the carers and the families who've been involved in this. We're going to make sure that this makes a difference. So thank you for everyone online who's been attending today and been part of this launch. I think this is a pivotal milestone launch in Australia, I really do. Thank you, everyone.
And that brings our event to a close this morning. For everybody watching online, there will be some communication tomorrow. So if you want more information to access about the plan, look out in your email. And for everybody in the room, please, even if you didn't quite have a question or it's just come up to you now, stay, have a cup of tea, and you can attack our panel later. Thanks, everybody.